Thank you. Further debate? The member for Perth-Wellington.
Thank you, Mr. Speaker, and I'll be sharing my time with the member from Bruce Grey Owen Sound. I am pleased to rise today to join in the debate on Bill 148, the Protection of Vulnerable Seniors in the Community Act, introduced by the member from Scarborough Agincourt. I have the privilege, Speaker, of representing Seniors Affairs on behalf of our caucus. I spend a lot of time meeting with seniors and associations that represent seniors' issues, both in Perth-Wellington and here at Queen's Park. I believe that Bill 148 is a step in the right direction when it comes to protecting seniors in Ontario. It also helps to raise awareness of elder abuse and to spur discussion about preventative measures against any type of abuse. At its core, the bill will require regulated health professionals to report any reasonable suspicion that a senior is being abused or neglected. That means that professionals, including but not limited to doctors, nurses, dentists, physiotherapists, and chiropractors, will have a duty to report any suspicions of abuse or neglect against a senior citizen. Currently, seniors residing in long-term care homes and retirement homes already have this type of protection through existing legislation. I support this bill's intent to expand that protection to seniors living in their own homes or in a living environment outside of a regulated facility. Before getting too far into the specifics of the bill, I must state that I know most healthcare professionals already do report any suspected abuse and that they take this responsibility seriously. I thank all healthcare professionals for their vigilance in keeping us safe and healthy. Under the requirements of this bill, if a certain healthcare provider did suspect the senior was suffering abuse or neglect, he or she would report this to a law enforcement officer, the public guardian and trustee, or another prescribed person. It would then be the responsibility of the Office of the Public Guardian and trustee to investigate all reports of suspected abuse to determine whether or not an application for a temporary guardian is required. No proceeding could be commenced against a regulated healthcare professional for making a report in good faith. Moreover, it will become a professional misconduct for a regulated health profession to fail to report a reasonable suspicion of abuse. We know that our province's demographics are changing. There are currently 2 million senior citizens living in Ontario. By 2036, that number is expected to double. It's important that we have the policies in place to ensure that seniors have access to the health care, residential supports, and transportation that they need. We on this side of the House have stood up for seniors when the government has cut important programs. For example, 2 years ago, the Liberals cut physiotherapy services for seniors by $50 million. As a result of those cuts, physiotherapy services for many seniors were eliminated. In many cases, individuals who still qualify for physiotherapy services must travel to off-site community clinics. It's not an easy task for seniors who no longer drive, especially in our small and rural communities. We called on the government to reverse this decision and brought the concerns of our constituents to the legislature. When it comes to the needs of our province's seniors, we in the PC caucus stand up for what's right. That's why I'm supporting this bill, because any type of abuse or neglect is unacceptable. I understand that based on the reported data, many incidents of abuse against seniors are committed by the individual's adult children or spouse. There is no doubt that many would find it difficult and emotional to report abuse by a loved one. That's why I believe it's important that those responsible for overseeing our health and well-being have a duty to report suspected abuse. Under no circumstances are abuse and neglect acceptable. And if registered healthcare professionals can protect someone from any further victimization, they should absolutely do so without fear of professional repercussions. I am pleased to support this bill to ensure that seniors feel safe in their communities. If anyone listening to today's debate is experiencing any form of abuse or is concerned that someone they know is being victimized, please report it. Contact your local police. They are there to help. Thank you, Mr. Speaker.
Thank you.